Hello, good afternoon, and welcome to episode 40 of 2 Minute Emergency. So before I get started, I just want to point something out. If you hear whining in the background, no animals have been injured during this filming. What it is my husband, on the way home while he was running the other day, found a lost puppy. And so this puppy is absolutely adorable, but he doesn't like to be left alone. So he's whining right now because he's not out with me. It's a puppy thing. We've all got to understand. Hey, Anna, how are you? Long time no hear. I hope you are doing wonderfully. Thanks for joining me today. So what is episode 40 all about? Today's episode is about palpitations versus arrhythmias. So let me start off with palpitations. Well, first of all, have you ever been to a movie that is either a horror flick or an adventurous movie, and you feel like your heart is just pounding because you are excited just like the character gets excited? Those are palpitations. Palpitations are basically when you feel either a increase, like your heart is beating heavier than usual. Sometimes it can be beating faster than usual. And those are the feelings that we get in those circumstances when there's increased adrenaline in our system. So everything is going a little bit faster and a little bit stronger than usual. These are generally very benign. There's lots of things that can cause it: exercise, stress, anxiety, and one of the big things is caffeine. So if you're not used to drinking a lot of caffeine, which hopefully most of you aren't drinking a lot of caffeine, but if you're not used to it and you get that espresso, double espresso, you just feel like your heart is racing. That's palpitations, but they're a known cause. So the caffeine is what's causing it. And in some people, just the amount of caffeine that's in chocolate can cause the same symptoms. Some of the other things that can cause it are alcohol, tobacco in some people. Then, of course, there are also some medications which can cause palpitations. And we sometimes use medications to treat palpitations, but that's further down the line. So what is an arrhythmia? So an arrhythmia is different. It can either be a rapid heart rate, a slow heart rate, or an irregular heart rate. So when we think of arrhythmias, the number one thing everybody thinks about is atrial fibrillation. And that's because that's what you see on commercials as they advertise for different medications to treat it, or medications to thin your blood. That's all part of AFib. So what is AFib? I like to give this simple demonstration. So a normal heart rate is going like this, opening and closing fully and getting a full beat. Atrial fibrillation is instead when it goes faster and you don't get that full closure. And so what happens is those are the fibrillations. Instead of all of the blood being pushed out, some of the blood gets stuck right there in the heart, and that can lead to blood clots. Now, in all honesty, if the blood clot is sitting in the heart, it doesn't do much damage. But if that blood clot is then pushed out, imagine it's going into the bloodstream, which is hitting any of your major organs. So it can go into the brain and cause a stroke. That's one of the main things we worry about. And that's the most common devastating event that can happen when you have atrial fibrillation and it's not controlled and you're not on any type of blood thinner. So that's atrial fibrillation, one of the most common arrhythmias. Others, as I mentioned, is going too fast. So the normal heart rate is anywhere between 60 up to 100. Anything more than that is considered tachycardia. And believe it or not, your heart can go in excess, not of just that 100 beats per minute, but it can go in excess of 300 beats per minute. Now, if your heart's going that fast, you can imagine it is not acting effectively at all. It is not efficient. So to speak, it's going to wear out soon. You are considered very unstable if that happens. Now, on the other side of things is bradycardia, when your heart rate drops too low. So anything below 60 is considered bradycardia. As most things that I mentioned to you, there's always a caveat. So with bradycardia, there are some people, especially athletes, runners, who, because they are in such great cardiovascular condition, their heart rate can function at lower rates because their heart is working so efficiently. So bradycardia isn't dangerous in all people. So when do you worry about these palpitations versus arrhythmias? Palpitations, as I said, are generally benign, and there's not much to worry about. But the times that you do worry is when these palpitations are lasting for more than a few seconds, and as I said, not caused by any of the things I mentioned, or if you have other associated symptoms. So you get shortness of breath, you get fatigued, you get dizzy, you get a headache, and of course, the big one everyone worries about is getting that chest pain or chest discomfort. If you have any of these symptoms, this is not something that you say, okay, I'll make a doctor's appointment and see them, a week down the line. This is something that you need medical attention immediately. Those are the times that you need to go to the emergency department. So, as I said, palpitations lasting just for a few seconds. Still, you want to contact your physician. If you don't have a cause for this, it's not that you were just running or just watching a movie that was full of excitement, it needs to be investigated. But anything that continues and you have additional symptoms, you definitely need to be seen. So I hope you learned a little something from this. And I realized I didn't introduce myself at the beginning. I am Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these 2-minute emergency sections twice a week in the hopes of keeping you healthy, safe, and out of the emergency department. So until next time, stay safe, be well, and remember, not all the things we feel are dangerous, but you need to know when they are. And keep in mind, anything that I've told you throughout any of these segments are not to replace the information or advice you get from your primary care physician. This is only to provide you information, and it needs to be taken within certain contexts. So if you have any questions, contact your primary care physician. Until next time, take care. Bye for now.